of our socio-economic life. On behalf of the Council, I'm delighted to welcome Professor Akin Abayomi, the Lagos State Commissioner for Health, who is a specialist in internal medicine, hematology, environmental health, and biosecurity, and is reputed for his extensive experience in the medical practice internationally and in Nigeria. One of today's panelists is Dr. Richardson Ajayi, a longtime friend and chairman, governing board, Lagos University Teaching Hospital. He currently serves on the board of various businesses, including the Bridge Clinic and SynLab Laboratories. Dr. Ajayi is an accomplished obstetrician and gynecologist and healthcare entrepreneur who has spent the last 22 years helping to shape our healthcare industry. Our second speaker is also a very old friend, a seasoned pharmacist who has led business transformation experiences at major organizations such as Pfizer Worldwide, Mike Adenuga Group, and BSN. Is Professor Lere Baale, Chief Executive, Business School Netherlands International. Our third speaker is the founder of a group which invests and operates across the healthcare and wellness value chain and has been actively collaborating with the government to find innovative ways to tackle the ongoing pandemic. I'm pleased to welcome Dr. Ola Brown, founder, Flying Doctors Healthcare Investment Group. Our moderator for this event is Fola Laoye. She's one of the top female executives in the Nigerian healthcare delivery industry. She's a board member and was previously CEO of Ajayi Group Nigeria, who are promoters of the Ajayi HMO and the Lagoon Hospitals. Mrs. Laoye is currently the CEO of Health Markets Africa. I'm quite certain that this eminent assembly of industry leaders will do justice to the subject, and we shall all be better prepared to ride the turbulence associated with the subject that we're addressing today. I especially recognize the Deputy Presidents of NBCC, Mrs. Abayomi and Alan Davis, and also recognize our patrons and council members who have joined us at this webinar. I also thank members of the Programmes Committee and our Secretariat for organizing this excellent event. The NBCC is a bilateral organization whose main objective is to foster trade and investment relations between Nigeria and the UK. It is 43 years old and currently has over 300 top corporate organizations in Nigeria and the UK as its members. I'm pleased to invite you to view a list of our members on our website. I also wish to draw your attention to the list of our premium members on that website. These include Standard Chartered Bank, PwC, Access Bank, British Airways, Custodian and Allied Insurance, First Bank, Fidelity Bank, UTL Trustees, and Wema Bank. I thank them for their guidance and support over the years. Indeed, this category of membership have been quite supportive of the chamber, and they are people that we owe a lot to. I would invite those of you who would like to become premium members to do so. That is a premier group of membership. The NBCC is an affiliate of the British Chamber of Commerce, which gives our members access to a network of 33 chambers across the UK and 40 other affiliates worldwide. Let me use the opportunity to invite forward-looking companies who are yet to join the NBCC to do so. In particular, I have the pleasure of inviting the Bridge Clinic, the Ajayi Group, Flying Doctors Healthcare, and several others on this webinar to commence the application process by visiting our website and filling out our membership forms. Upon completion of the process of admission, you will have access to the tremendous benefits attributable to membership of the foremost bilateral chamber in Nigeria. Ladies and gentlemen, please permit me to draw the attention of this special audience to our NBCC Plaza project. This is a 4-story structure currently being developed at Lekki Phase 1 by the chamber to provide accommodation for our secretariat. It also will house an incubation center for British businesses in Nigeria and provide a center for seminars and trainings to our members and the general public. I wish to take this opportunity to acknowledge all stakeholders who have made special contributions towards the development of the plaza. Some of these are the Dangote Group, Greenwich Trust Limited, Shell Group, and so many others whose name I have not mentioned today. While noting that significant progress has been made with the support from all our donors, we will still require additional funding to ensure timely completion of the plaza. We look forward to contacting some of you in this regard, and we'll be pleased to receive your support in cash and kind. Regarding today's topic, we note as a chamber that with over 22 million cases and about 790,000 deaths globally, the world continues to battle the COVID-19 pandemic. While many developing countries have recorded relatively low cases, Nigeria has reported over 50,000 confirmed cases and 985 deaths as at yesterday. Our healthcare system was grossly underprepared to deal with this pandemic and still lacks the capacity to cope with the public health issues it has thrown up. In 2017, for example, the World Health Organization ranked Nigeria's health system number 187 amongst 191 member states, only ahead of Congo, Central African Republic, and Myanmar. Obviously, that is not a good group to belong to. The WHO also recommends that physicians' density should be 1 doctor for every 1,000 patients. I am informed that in Nigeria, it is about 2,600 patients per doctor. Clearly, there are a lot of challenges in the health sector. Some of these are the poor hard and soft infrastructure position, poor financing mechanism for players in the sector, and low level of universal health coverage. You might know that only about 5% of the entire population of this country is registered in one form of health insurance program. Now, going to our Nigerian 2020 budget. This year, Nigeria proclaimed its largest budget so far of 10.3 trillion naira. However, only 427.4 billion of this amount, that is about 4%, was allocated to the health sector. This is significantly below the 15% benchmark set by the African Union to promote healthcare delivery across the continent. Of this amount, about 336 billion is budgeted for recurrent items, leaving only a sum of 46 billion for capex investment and 44 billion for basic healthcare fund. Therefore, from a government budgetary perspective, Nigeria allocated approximately 2,000 naira to meet the health needs of each citizen per annum. Surely, this is undesirable, particularly when we note that Nigerians spend a lot of scarce foreign exchange resources on seeking medical help abroad. According to the PwC report in 2016, Nigerians spend over $1 billion annually on medical tourism, with 60% of this on 4 key specialties of oncology, orthopedics, nephrology, and cardiology. Surely, it should be clear to anyone that investment in those particular specialties would have adequate patronage in Nigeria and help to stem the outflow that we currently witness. In order to deliver healthcare services that approaches the standard available in developed countries, we require a massive dose of investment in the sector, and we need to find more sources of finance. It is instructive that Nigeria's handling of the COVID-19 pandemic has given a pointer to how public-private partnerships can help solve the challenge of the country's healthcare infrastructure. For example, many of the facilities for testing and for managing COVID-19 patients were provided through investments from the private sector. In fact, across the world, private sector-led investment is shaping the healthcare sector. Investors are naturally attracted to the sector due to rising demand in both developed and developing countries and the limited exposure to economic shocks. In concluding, I would like to state that a more integrated response spanning several sectors, including the healthcare sector itself, the finance sector, and trade sector, is required to address the structural issues in the industry. With a poorly funded healthcare system for 200 million Nigerians, the challenges we face in the industry and the effects of the COVID-19 pandemic means that there must be urgent prioritization of this sector. This will require a lot of coordination between the Nigerian government, the private sector, and indeed the general public. Ladies and gentlemen, I thank you for your attention and wish you all a productive session. I now have the pleasure to invite today's moderator, Mrs. Fola Laoye, to kindly guide us through what promises to be a very exciting webinar. Thank you very much. Mrs. Laoye.
Good afternoon, ladies and gentlemen. Thank you very much, Mr. Fola, for your opening remarks and your kind words. And shall I also say thank you very much to the Nigerian-British Chamber of Commerce for holding this webinar and on this very topical issue, of course, of healthcare and the future of the Nigerian healthcare industry. I think certainly, all housekeeping and so on has been done. So it's left with me to really just try and dive into the subject matter. And of course, we have such eminent speakers who, will address, all the different issues, hopefully, as we get through the session. I think perhaps maybe just to say, in addition to what Mr. Fola, he's laid it out so well, really where we are in terms of the healthcare system of Nigeria. But perhaps just to say that maybe on my own personal note, having been very much a, not just a bystander, but I guess an active participator in the sector for the last 20 odd years, to say that I certainly, look to where we have got to right now with the healthcare system. Having just gone through the last 6 months, which has been, of course, the beginning of our response to a virus pandemic, which was completely unknown to most parts of the global healthcare system. And where we also, even with that in mind, have to look forward and have to review our existing healthcare system to deal with the continued presence of this pandemic as the rest of the world now reopens for business, whilst at the same time wanting to ensure that we have a healthcare system that can deal with all the both communicable and non-communicable diseases which have been rising over the years. Indeed, we are really plagued with the low level of financing for the sector. But at the same time, I very much look to the future with optimism about the opportunities that behold themselves, the opportunities of growing our healthcare system by growing our supply chain actively, by creating more jobs in the space, certainly growing the demand side through health insurance, and most particularly bringing up and coming the role of the private health sector and really being able to integrate that into the health systems. On that note, I'd like to first ask us to give our attention to the Honorable Commissioner of Health, Professor Akin Abayomi, for him to share his own thoughts about the future of healthcare in Nigeria, and obviously from his own vantage point of having both responded so quickly and smartly to COVID, and of course to the teeming needs of healthcare in Lagos. Prof, sir.
Thank you very much, Ms. Laoye, and to the distinguished panel on this webinar. And thank you for the opportunity to address some of the concerns that you've already raised as part of the poignant issues that we face in healthcare delivery in Nigeria and also in Lagos. So can you see my screen?
Yes.
Okay. Okay, some of the issues that I'm going to talk about around the situational and fiscal analysis of the space we're talking about, some of the issues around our journey on the universal healthcare coverage, an overview of the basic healthcare provision fund, the breakdown in allocation, the impact of healthcare expenditure around COVID-19, the future of healthcare in Nigeria, and some strategic planning and potential sources of income. So as you've clearly seen, we obviously recognize that Nigeria has a very weak healthcare system and healthcare processes. If you look at the global picture, we can see that out of the 24,000 PHCs in Nigeria, only 20% are functional. And when you interrogate those 20%, you see a wide range of dysfunctionality, a wide range of a dearth of human resources for health, and a low level of a standard of healthcare delivery. As a result, that causes a heavy burden on our general hospitals because of the primary failure of that family medicine platform. That also puts a load on the tertiary facilities, which are supposed to be reserved for cutting-edge research and complicated specialist cases, because they are now relegated to supporting the general hospitals in trying to provide basic health care and some level of specialist care to the general population of Nigeria. And you've just heard from the introduction, the indices that we have in terms of our mortality and coverage rates. And you just heard that we have a very low shortage of healthcare personnel per population. And malaria there representing as a surrogate marker of the disease burdens in Nigeria. So high disease burden, low human resources for health, across the spectrum, high indices of disease burden in terms of mortality and morbidity, and a very weak infrastructural landscape for the country. Then we look at the expenditure on health, and of the estimated total expenditure in health of $14 billion, you can see that the predominant contribution to that expenditure is coming from out of pocket. So that means Nigerians are actually paying for their health out of their hard-earned earnings. And when you look at the poverty index in Nigeria, when we talk about an illness being one, putting up our communities one step away from extreme poverty, I think you can appreciate what this figure actually means. If 77% of people in Nigeria have to pay for their healthcare, that is an extremely huge burden on our communities. And then you see a very low level of government expenditure in health of 14%, extremely low. And that is reflected by the amount of money that is dedicated to health by the government, where we see that it's less than 5% of total budget, which was alluded to. The target being a minimum of 14 or 15% of budget to be directed towards the healthcare sector. And being in government myself, I can tell you that these are just figures. Because when you look at 5%, you're not even considering the budget performance. So we can pat ourselves on the back and say, okay, we've spent 9% of total budget on health if we're doing very well. But then what does that budget actually mean? It's just a figure. It must translate into budget efficiency and performance. And if your budget is running at a performance of 40 or 50%, and that can be divided into drawdown and translation into tangible programs, then you'll be looking at somewhere between 2% or even less. So that 5% is deceptive. When you look at what actually translates into an effective program, my guesstimate is that it's between 2 and 3% at best. So those are some things that we need to pay attention to. Of course, our universal coverage for health journey has been checkered. That is the historical spectrum of what has been happening. But let me just home in on 2017 when we made the provision for the Basic Healthcare Provision Fund in 2018. Of course, it wasn't adopted because of some significant flaws in the guidelines. And principally, Lagos refused to engage because we were very opposed to the manner in which the Basic Healthcare Provision Fund was to be adjudicated. Finally, in Asaba, in late 2019, we were able to raise this issue, and thankfully some very significant players in the game were able to rally around and identify some of these complaints that we had. And the guidelines have been revised, and only a few weeks ago they've been adopted. And Lagos State is supportive of the new guidelines, and we will engage fully now to participate in the BHCPF. So the BHCPF, as you can see, has 3 gateways. It represents 1% of consolidated federal revenue, which is quite a lot of money, but it's to be shared through all the states. And the 3 gateways are represented by 45% going to the Primary Healthcare Development Agency to be distributed to the state primary healthcare boards. 50% to go to the demand side of state health insurance schemes, and 5% to concentrate on building an emergency medical strategy for each state, comprised of day-to-day emergencies and possibly to cater for public health crisis, as we've just seen in the COVID-19. And it's broken down a bit more, as you can see on the slide. For the primary healthcare level, 10% is to go to human resources for health, 15% to infrastructure, and 20% to consumables, vaccines, and essential drugs. So even though we've been contributing very little towards healthcare delivery, you can see in orange that the BHCPF actually is going to top up this meager expenditure as it exists. So it's not a negligible contribution. And if used correctly and wisely, it will make some degree of impact. The impact of COVID, it has certainly drawn attention to the weak health infrastructural systems that we have. It has drawn attention to our weak manpower in the health sector. It has triggered a number of things. The absolute necessity for review of our acts and our policies, guidelines. We all know that globally, it has changed the landscape of health. And definitely it points towards health, not as a social component of governance, but it demonstrates quite clearly that the health sector is a very important economic driver of any state, any government, anywhere in the world. So COVID-19 has definitely shown us that while we're grappling with what we think are mundane medical issues like malaria, TB, malnutrition, the international community are talking about, important predictions. WHO has been shouting about Agent X for a long time. We have a whole list of probable public health crises and biosecurity threats that are looming. Ebola certainly opened our eyes in West Africa in 2014, and that has been followed by a number of smaller threats, biosecurity threats. Lagos State took the Ebola experience very seriously because we know how close we came to a disastrous situation, and we're not going to be caught napping. We were following the trends and recommendations of the WHO that another outbreak of some unknown pathogen was imminent. While we were expecting the pandemic flu to be that event, the SARS COVID virus 19 popped out of nowhere and became the harbinger of what we expect. And let me just remind everybody that the WHO is still expecting another pandemic event other than COVID-19 and likely to be a pandemic flu virus. So hopefully we would have learned a few lessons from the COVID-19 experience. COVID-19 has done a number of things. It has triggered the need for digital health, for inventory management, for logistics, and to use modern technology to deliver health in more ways than the traditional ways. But it also opens up the danger of data. Data is critical. You must use data to plan your strategies. You must use data to define your policies. You must be guided by what's happening in your environment and not try and use copycat medicine based on what other people are doing. We used a lot of data to drive our policies in Lagos, and we soon discovered that copycat medicine was not going to work. We needed to understand the outbreak as it was unfolding in Lagos and in Nigeria and across the sub-region, and adapt our strategies and our policies to suit the local environment. Otherwise, we would have run into a lot of trouble. And the use of research during an epidemic or a pandemic, I can't overemphasize it. It is critical that we use a combination of data and research to plan a local and indigenous response. It's also important that we pay attention to the protection of personal data. I think a lot of people are jumping on the bandwagon of digital health, telemedicine, and not paying attention to the data protection regulations. The Ministry of Health in Lagos is taking the protection of personal data extremely seriously, and we are not tolerating any unregulated accumulation of data that we consider to be sensitive. And we're going through the process of data regulation and compliance within the state. And as a government, we're going to regulate that space very, very thoroughly and very carefully. When we look at the future of healthcare in Nigeria, we look at the state-led mandatory insurance schemes that will be addressing the demand side, the addition of the Basic Healthcare Provision Fund, the incorporation of the local governments, and of course, public-private partnerships to drive the supply side. So the government won't be held responsible for funding health if we have insurance schemes or social insurance schemes that in principle act as banking organizations in health. As people pay their contributions, then capitation can be delivered to the supply side, which is competitive and which will improve the standard of health because the number of clients you have be based on the principle of performance and excellence, and therefore will reflect in your capitation. So if you're delivering a poor service, then your clients have legs. They will walk to where they can find better services for their money, more health for their money, and therefore the number of people you have registered on your books will be a reflection of the quality of health service that you deliver. And therefore, this capitation process is a very interesting process, which not only helps you to build the quality of your supply side, but also is competitive in nature. And the better you do, the more clients you will get. So in Lagos State, we have our health hierarchy, which builds on the demand and the supply side. We have the Lagos State Health Insurance Scheme. And then we have the supply side, which are the primary healthcare platform of over 300 facilities and our 26 general hospitals and 10 maternal child centers. And for now, our one tertiary facility called LASUTH. And underpinning all that is our emergency service, LASAMBUS, and then our shared services, which are coming on board. The SHIP, which represents the State Health Information Platform. We have the Lagos State Biobank, which is gearing up to regulate the inventory management of samples and data within the state to ensure that we have and can impose the appropriate governance over the sovereignty of sample and data that emanates from the state. We're building our blood bank services, and we've developed a grants management office to attract third income streams, particularly from the developmental partners. So all in all, we hope that this journey is going to improve. We've had the experience of COVID, which has exposed a lot of our deficiencies and exposed a lot of our systematic failures. And it has been a blessing in disguise. And thankfully, we've been able to rise to the challenge. But certainly after COVID, we're going to go back to the drawing board, and we're going to see where our major inefficiencies and gaps are, where they, both in terms of policy, both in terms of systems and infrastructure, and to try and dramatically engage with private sector to deliver to the communities of Lagos a higher level of healthcare service delivery. So traditionally, most governments are relying on the historical methods of financing health, which are traditionally from, on the public side, from government budgets for healthcare, heavy reliance on government, very low attention to income generation within the sector. Everybody thinks that health is a social service or a social safety net, which indeed it certainly has a significant component of that. And then a heavy reliance on donors, developmental partners, and third income streams. But in Lagos, we're trying to shift or move away from these traditional methods. While they will still exist, we are trying to interface with public-private partnerships and to move away from the paradigm that the government should be responsible principally for healthcare delivery within a state. We recognize the importance of the private sector, and we also recognize the important role of the government. And it is our opinion that while government will be providing a certain amount of healthcare delivery to particularly the indigent population, that our main function is to create a regulatory environment, to set the standards, the benchmarks, to be public protectors, but also very importantly, to create an enabling environment for public-private partnerships. We're also very keen to develop specialized economic zones within the health sector, that we can make the environment attractive to investments from abroad, and particularly to try and attract our very large healthcare diaspora back home to come and contribute to the building up of the Lagos state and Nigerian health fraternity and expertise. So these are some of our new strategies that we're going to be deploying in Lagos to move away or to incorporate into the traditional methods some futuristic way of thinking and operating outside of the box, which up till now we can certainly say has been substandard and definitely not meeting the needs of the general public. So on that note, thank you once again for inviting me to give a perspective. I come from the traditional setting of academia and to some extent private sector. So my way of thinking has been dramatically transformed by being in government. But being a heavy critic of government in the past, I now understand that there are severe limitations. But what is important is that government continues to play the role of regulator, public protector, policy development, create the enabling environment for the private sector to do what it knows how to do best, and to trigger the environment for international investment in health that is conducive to the inflow of not only capital, but human resources to work in an environment that is a win-win situation for everybody. On this note, I'd like to thank everybody for setting up this webinar. I think it's important that we address these issues. Post-COVID, there's going to be a lot of soul searching. There's hopefully going to be a lot more understanding of what needs to happen in the healthcare sector. Health and education form the basis of human capital. And every country must understand that human capital is the basis of your economy. And if you don't provide a healthy population from birth, and if you don't subject that healthy population to good education, then you are shortchanging yourself in the fact that you may never achieve the opportunity to join the global economy because you are deficient in your human capital. So thank you very much, and I wish you happy deliberations. I will listen to some of the presentations, but sooner or later I'm going to have to leave to attend to some other matters. But I appreciate and I look forward to the proceedings moving forward. Thanks once again. I'm open to some questions if there are any at this point in time.
Thank you very much. Thank you very much, Prof.
Thank you.
Thank you very much, Prof. Apologies, I seem to have a little bit of internet interruption, but hopefully it will stabilize. So thank you, and we're going to move swiftly on now to our next speaker, Dr. Ola Brown. Ola, if you could please put your camera on. Great. Okay, so Ola, I think really and truly, you know, you are probably one of the most, shall I say, active, you know, spokeswomen at the moment for, you know, sort of the commercial side and the private side of healthcare in Nigeria. So why don't you just sort of give us really, you know, how you see it, you know, what do you really see as what the role of the private sector can play? I think we've heard very much from Prof and from government about how much they are looking now to the private sector to come in and really support the efforts and help to grow investments and so on. So, you know, what's your comeback?
Okay, thank you very much, Fola. I'll start with a story from medical school, actually. I only have 5 minutes, so I've set my stopwatch, where I worked really, really hard to memorize something called the Krebs cycle, which is like a very complex cycle of how the mitochondria in cells process energy. And I was so pleased when I managed to memorize almost all of it, because I thought that that was the moment that I could really, you know, make a difference in healthcare, because I'd memorized this complex physiological cycle and all the different steps that it takes in the processing. So you can imagine how surprised I was when Bill Gates visited Nigeria 5 years ago, I think 6 years ago now, and he wanted to revolutionize the healthcare sector as well. And when I was going between my cardiology conferences and my emergency medicine conferences and my air ambulance medicine conferences and the basic medicine conferences, the people that he called actually to help him revolutionize the healthcare sector were not people that memorized the Krebs cycle, or people that went to cardiology conferences, or people that knew anything about biochemistry or pharmacology or physiology or anatomy. When he wanted to change the health sector, he called 2 bankers and a cement producer. And I think that that was when I realized something that obviously one of the smartest and wealthiest men in the world had realized, you know, decades ago. That healthcare is about all of those things, like the Krebs cycle and anatomy and physiology, but it's also about business. And if you want to change the healthcare delivery in Nigeria, then I think what he recognized and what I began to recognize from this moment is that healthcare is trade, it's industry, it's business. And when we bring that kind of efficiency, when we bring the kind of competition, when we bring the kind of service delivery and customer service delivery that the private sector has been known for and the private sector has used to revolutionize almost every sector in the world, we bring something really special to healthcare. And that's what really I wanted to talk about, the role of the private sector in healthcare and the role of trade and investment in healthcare, and perhaps talk about a way that we can change the lens through which we look at healthcare, speaking to the British American Chamber of Commerce, British Nigerian Chamber of Commerce especially, changing the lens that we look at healthcare. Because when we think about business in Nigeria, we don't typically think about healthcare as a business. When we think of business people, we think of the Dangotes, we think of the Buas, we think of the MTNs. We don't think about healthcare as a business. We see it more as a social effort or a philanthropic effort. But in order for the banking industry to undergo transformation, the running of the actual industry moved from government hands to the private sector hands. And we saw like this huge expansion in banking and new ideas and innovations, to the extent that it takes longer and it's more difficult to transfer money in America from bank to bank than it is in Nigeria. And the same thing happened in the telecommunications industry, where, gosh, like my parents, I can remember when we used to have to call Nigeria on those Nitel lines. It was just so difficult and frustrating, like to call. But obviously, when those licenses were handed out and the private sector was able to take over, we've created, very, very big businesses. We've created jobs. We've created wealth. And I'm really hopeful that the same thing will happen with healthcare. So after this meeting, I actually went back to school, but not to study the Krebs cycle. I actually started to study finance and economics, eventually taking my master's in finance and economics, and reinventing my company into a healthcare investment company, which made investments in different areas of healthcare. And the reason why is because there are huge challenges, like the commissioner mentioned, the Honorable Commissioner mentioned things like the out-of-pocket spend. He mentioned things like the maternal mortality, the number of doctors, doctor-to-patient ratios, the neonatal mortality. But I think even in these problems, there are a lot of opportunities for Nigerians and Nigerian entrepreneurs to be able to innovate. So if you look at Ethiopia and Nigeria, if we're just to raise our local share of drug production from 15 to 45%, we could see our trade balances increase significantly. So these are all good things. And also, I think healthcare we don't give healthcare as a business as much credit as we should. And I'll just summarize this slide because I'm looking at the time. Healthcare actually has a massive multiplier effect. So for every one job created in healthcare, there are 10 additional jobs created for the economy. So it's actually a very, very good industry to invest in from a macroeconomic point of view, especially in a country like Nigeria that has really large numbers of unemployed people. And I think that this is super interesting and will be quite surprising to people that haven't really sort of studied doctor exports. So in 2018, Nigeria made 18 billion. So the Nigerian government gross oil revenue was 18 billion naira from oil, which is, what every state in Nigeria relies on, right? Nigeria is obsessed with oil. Oil is like the only thing that we make forex from. Cuba, this year, because of COVID-19, will make almost the exact amount of money from exporting their doctors. So what they do is they train a lot of doctors and they don't give them away for free like Nigeria. They charge for every single doctor they export. So they have doctors working all over the country and the percentage of their salary goes back to Cuba. But it's such a significant business for them that it's their biggest source of forex. But it also makes almost the same money as Nigeria makes from oil, for a much smaller population. I mean, Cuba's population is 11 million compared to Nigeria's population of 200 million. But it's estimated that they'll make 16 billion from doctor exports, which is probably about double the amount that we'll make from oil and gas this year because of the oil and gas prices. So when we change the lens that we look at healthcare and look at our resources, then I'm sure we can find really innovative business models that we can use, not just to increase the quality of healthcare here, and perhaps external revenue earners as well. If you look at Mediclinic in South Africa, people don't see hospitals as business. We see business in Nigeria as telcos, as cement, as people in power. Those are real business people. But actually, Mediclinic in South Africa made more money than Dangote last year, and this is a hospital group. So again, this lens that we see healthcare, the idea of it changing from a social endeavor to more of a serious business. And here, when you look at sectors of the biggest revenue earners in America, you can see that actually there's no sector, not in technology, not in oil and gas, not in banking, that is as well represented in terms of the top 10 revenue earners than healthcare. So 3 out of America's top 10 revenue earners are healthcare companies. And this just shows the potential, not just as a social investment, but also as something that will generate jobs, that will boost the economy, that will create forex sources for us, and will also improve the health and well-being and therefore the productivity of Nigeria. So my time is up now, and I kind of rushed through those slides, but I think sort of the main point I was trying to make to the audience in the chamber especially is the fact that if we simply change the way that we look at healthcare and healthcare investments, I think we can find a lot of real opportunities, not just to change the healthcare system, but to change the economy of the country. Thank you.
Great. Thanks very much, Dr. Ola Brown. That was a good comeback, shall I say. And I hope that we can take some questions at the end as well that will delve into the role of the private sector and private investments. So moving swiftly on now to Dr. Richard Ajayi. Richard, can you please have your camera on so we can see you? Yes. Excellent. Great. Okay, so, well, Richard, you were introduced today as chairman of LASUS, and I know that, yes, you've got that public health cap on, but I'm going to task you more on the private side. Of course, you've launched several private initiatives in healthcare, Bridge Clinic, SynLab, and so on, and of course, even in health insurance with an HMO. So I'd like to really ask you perhaps to give us your own view of really, even as we're talking about the future now. So really, what would you say would be for you, what are the ideas, the innovative ideas you're thinking about for healthcare, in Nigeria from the private lens, perhaps really tackling the issues around tertiary care, because that's an area you know well, and as well as health financing, because I'm sure you have, much more ideas on this, and that would be great for the audience to listen to. So let me ask you to please take it from there.
Okay, thank you very much, Fola. And also let me thank the Nigerian-British Chamber of Commerce for this invitation. And it's been nice hearing Prof and Dr. Ola Brown, and I think they set the scene for my discussion. So in response to the questions you've asked me, Fola, I think the points that Ola makes about the private health space, I think is an important one. But I think we need to look at the realities of the Nigerian situation. If you apply a framework that I like the Porter's 5 forces, and this looks at the profitability of any industry, and it looks at the power of buyers in that industry. It looks at the power of suppliers. It looks at the barriers to entry, threats of substitutes, and the rivalry within the industry. And when we look at all those 5 forces and look at the healthcare space in Nigeria, I think it's not surprising that we've not been able to accelerate growth in the private healthcare space, because it's 70% of purchases are made out of pocket. And as such, it's very difficult for a lot of people to afford healthcare. there is not a lot of regulation in the space. So you may put a lot of money in and build a world-class facility, all bells and whistles. But the next guy builds something of a lower standard, he competes with you on price. Now, these are issues that are dealt with in a lot of the countries. Like we know that healthcare, the size of the market is a lot larger. I mean, if I look at the UK, for example, if I think about it, I think there are about 2 or 3 private hospitals that have a license for maternity care in the City of London. In the City of Paris, I think there are 2 IVF clinics, because they have a license because they can provide services to a certain market, and they've met the standards required to provide those services. We don't have those systems in Nigeria. So there's a lot of commoditization in the space. Then we look at the power suppliers. I mean, we have to import almost everything. Now, when you look at the foreign exchange challenges we have, all of this adds to a higher cost of delivery. Look at the threats of substitutes. Regulation will sort this out as well. And then the power of buyers I mentioned earlier, universal health coverage. We've been talking about this for many years. And I think the sooner we get it implemented, the better. So my point is we need a strategic approach to the whole industry. Because if we don't deal with these issues, the talk about accelerating healthcare will continue. We have to integrate our regulatory framework. We have to implement universal health coverage so that people can pay for healthcare. We have to domesticate a lot of our supply issues. So that's one side. Then we have to look at innovative ways of delivering healthcare. I mean, I think it was a great Canadian ice hockey player that says, I skate to where the puck is going to be, not where it is. And as we look at healthcare, we need to look at what's happening in the rest of the world. The rest of the world is really complaining about the cost of healthcare. People are getting older with the burden of non-communicable diseases. Expectations are increasing. So as we define our healthcare system in Nigeria, we have to say, well, listen, how can technology help us? And I know that the Honorable Commissioner mentioned about telemedicine. But telemedicine, I think, has a real role to play, but not on its own. I think we need to integrate it into the whole customer journey and really drive customer centricity to really drive adoption. Because most patients want to see their doctor, but if you can integrate, there's a company in America called Sherpa, which is really primary care in the cloud. You can you can sit in your office, send a WhatsApp to a doctor, you get a response. If you need to get tested, it's all in the same platform. Someone can come to your office to test you, or you can go and get tested. On the same platform, a prescription can be sent out to you. So these are really innovative methods. And as you know, primary care really drives about 80% of healthcare needs. So if you're able to get innovative methods to deliver primary care, then there's a real opportunity for us to accelerate real improvements. Then I want to talk a bit about the government sector. I mean, as you mentioned, I have been involved in government. And I think one of the key issues I'd like to talk about is really improve utilization of the limited resources. We build hospitals, very few of our hospitals are purpose-built. And even when we build hospitals today, we're building them, we're not really getting the right level of competence in terms of delivering the solution. So we build the buildings, the contractors sometimes don't have the experience in building hospitals. All of this doesn't drive delivery, and the resources are not effectively utilized. Another issue that I think that we should look at is actually management of our hospitals, because we see these hospitals as social services, but the level of investment that the government puts into the hospitals in terms of paying staff salaries, in terms of maintenance, is significant. And as Ola said, we have to increasingly see healthcare from that point of view. It's a social service, but it still costs money, and someone has to pay for it. So I think the need to really have competent management, having boards that are effective with clear terms of reference and very clear key performance indicators to drive engagement, as well as making sure that the management is also effective. The tradition we have is for doctors to manage our healthcare systems. And I think a doctor really is the best person to manage a healthcare hospital, provided he has learned management. The fact that you're a doctor, if your experience is in treating patients, there's a big difference between the practice of medicine and the business of healthcare. And if we make that distinction, we need to understand that you need to build capabilities with the doctors for them to be able to meet these needs effectively. The other issue you asked me to talk about is the role of our hospitals in future pandemics. I think we need to build pandemic readiness into our healthcare infrastructure. We need to be able to meet the day-to-day healthcare requirements of the state where we meet the demands of the pandemic. And one of the things we dealt with the pandemic we had just come out of is that a lot of people really were afraid to go to hospitals because they didn't want to catch COVID. A lot of people who had COVID could not get into hospitals because of the fear they would infect everybody. So it was a catch-22 situation. And I think, looking at our healthcare infrastructure and really earmarking some facilities and say, listen, if this happens, this is what you're going to do. And making sure these facilities are equipped to meet these needs. And I think a lot of learnings were gained from Ebola. And I think, when I look at the infrastructure we have in Lagos State, for example, the testing facility at IDH, that came out of Ebola. And that was necessary to meet the demands of COVID in Lagos State. And I think, looking at manufacturing, because we struggled with getting PPEs and supplies in, and I will reiterate the importance of looking at stimulating a lot of local manufacturing. And yeah, I think those are the issues I want to cover. Thank you very much for that.
Thank you. Thank you, Richard. We're going to come back to you, of course, with questions. But just before we move on, I wondered if we could take, sorry, I'm just trying to, okay. I wondered if we could take a question quickly for Honorable Commissioner Prof, who would have to leave shortly. Prof, we have a few questions in the chat box for you, but perhaps the one that seems to resonate the most at the moment seems to be around, first of all, really how much is Lagos State itself spending on healthcare? If it is possible to enlighten us, that we do have an idea of what the national average is, but could you perhaps hone in on what Lagos is spending? But in addition to that, I think also the idea of, what can the members of the Nigerian-British Chamber of Commerce, in what sort of real way can they participate in really sort of helping you craft the ideas around the role of the private sector and how private sector can support healthcare, starting with Lagos. So I don't know if you could please take those two. So first of all, what's the level of spend? And then secondly, what role can the the Chamber of Commerce play as you really sort of forge ahead with bringing in the role of the private sector? Thank you.
Thank you very much for that question. So the percentage of the budget that's allocated to health has been rising by the year. So last year it was on average about 11% of Lagos State's budget was allocated to health. This year it went up to about 12%. And we are already looking at a further increase for 2021, which has not only been triggered by the general advocacy to achieve the Abuja Declaration, but also the experience with COVID, as I said earlier on, has really shown us to be below the threshold. But as I alluded to before, it's not just about allocation of funding. It's also about efficiency. It's about systems. It's about, as Dr. Ajayi just clearly articulated, it's about developing a strategy whereby you are putting in place structures that are appropriate. You are looking for international benchmarking. You're looking for international standards. If you can't do something, then look for somebody that can help you do it, rather than developing systems that are substandard and we continuously spending money on things that don't work. The total budget for health in monetary terms is slightly in excess of 70 billion naira, which goes towards human resources, salaries, it goes towards maintaining hospitals, it goes towards building new hospitals, it goes towards consumables and drugs and programs. So every year we have an allocation, say, to capital. What we're trying to do now is to replace our non-fit for purpose infrastructure by specially designed blueprints across the 3 levels of healthcare delivery, whereby we're now going to be replacing our old non-medically designed facilities with fit-for-purpose designs that will form the blueprint. And we hope that the landscape of healthcare will change over the next couple of years to show a design by a culture by design rather than a culture by default. We're also paying attention to the manner in which we spend the budget. We want to spend less on healthcare delivery and a lot more on programs, on policies, on creating that critical link between the public and the private sector. We want to spend time on raising the standards of healthcare delivery. We want to spend time on being the public protector and enabling the environment for the private sector to flourish. We also want to put in place, obviously, the critical insurance scheme so that the government or the private sector or donors are not burdened with the demand side of providing health to our population. Where I think the Nigerian-British Chamber of Commerce can be of great assistance is in helping to achieve this newly defined role of government. And there are certain ways that can be done. There's lots of expertise around the world. There's lots of expertise in the private sector. And the Ministry of Health and other departments and agencies associated with health are beginning to tap into this kind of expertise through technical assistance and through regulatory frameworks to support what the government is doing. So I think in terms of policies, we need to relook at our policies. We need to look at our Health Reform Act. We need to look at bringing in technical assistance to support the activity of the Ministry of Health. Right now, I'm putting together a team of private sector technocrats to support some of the ideas and inject some new concepts into public service thinking. And they work nicely and synergistically with the traditional team on ground. So for example, in the entire Ministry of Health up till recently, we never had a health economist. And now we have engaged several health economists, and they are, I don't think any Ministry of Health around the world, the role of government is, as I said, is to define health as a key resource. And the only way you can do that is to work with health economists and other kinds of economy experts to help you to define those strategies that will be of importance in defining the pathway that the government should proceed through. And then that will lead to an increased budget efficiency and implementation of programs that actually have impact. And then finally, I think around the area of digitalization, I mean, it's so important that we engage with the digital space, and that will help us to make our healthcare delivery faster, more efficient, more accountable, and more able to project trends into the future and meet those trends. Around the area of administration, I totally agree with what Dr. Ajayi said around the area of hospital or health management administration. We are also looking at adapting slowly to that paradigm thought that, you know, there's a big difference between being a doctor and being a doctor that understands administration. And with the poverty of healthcare expertise in the country, we just generally feel that it's a form of internal brain drain when you're using specialists as administrators. I'm not saying they shouldn't be, but I'm just saying that we should support them with professional administrators who can spend their time with the mundane running of health facilities and allow our specialist doctors to play more of a role in delivery of health rather than wasting time with making sure the infrastructure is kept up to performance level and worrying about, you know, the huge burden of administration. So I think essentially, I think that answers your question. Thank you.
Thank you very much, Prof. I'm aware that you may have to drop off shortly, so thank you very much if you do for your time and for your contributions.
If you have more questions, I'm still available for a little while. Okay,
great, thank you. But we will have to very swiftly, though, take our last speaker as our time is well spent. And that is our Professor Lere Baale. Lere, please, can you show yourself? Put on your camera. Thank you very much. Thank you. So welcome, and we're very happy to have you. In the interest of time, though, unfortunately, this is what happens to the last speaker. Gets all the pressure. Can we ask that you really condense your own discussion into not more than 10 minutes so that we have some more time for Q&A, as we have quite a few questions waiting. We'd really like you to address, given your background in the pharmaceutical space, we are aware that the pharmaceutical industry has a major opportunity in Nigeria, across Africa, but at the same time has major challenges. We know that 70% of drugs that are consumed in Nigeria are imported. We know that there's a big risk at the moment in terms of self-medication and fake drugs and so on. We've seen how important the supply chain has been, not just in Nigeria, but across the world in the response to COVID-19. So I don't know if you could please just really take us through those types of issues and help us to shape what we think would be useful in the future to really grow the drug and pharmaceutical industry. Thank you.
Thank you so much. I will just go straight, since I'm focusing mainly on the pharma industry. The future for the Nigerian pharmaceutical sector in the healthcare industry is very bright. One, from the perspective of population, Nigeria will be about the third biggest country in about 2050. That's about a generation's time. It's third to only India and China. And about 50% of the world's population growth will come from 9 countries, for which Nigeria is the second. So there's a huge, this population will require large chunk of pharmaceuticals to consume. Nigeria economy is the biggest in Africa. Either you use the official rate or you use the market rate. So in spite of some of the bad news that a lot of people in the media carry, Nigeria is still an attractive location for investment in Africa. Indeed, in another survey, it showed that we are actually the #1 country when it comes to for doing business. It may not be the #1 in terms of ease of doing business, but overall rating for doing business, when you consider 8 parameters: data on population, nominal GDP, GDP growth rate, GDP per capita, current account balance, foreign exchange, and co. In terms of financial strength, we are number 14 out of 66 emerging economies. So in spite of our borrowing, the only thing that is occurring that's a little bit orange is the cost of borrowing is high. Every other thing, we are in the light blue area, we are number 14. We are not doing too badly. COVID-19 has gotten us to a situation whereby we are moving away from fear zone, we are moving to learning zone, and this seminar is part of learning so that we could grow. Luckily for us, medical supply and services, as well as personal and healthcare, they account for substantial part, and it's very, very beautiful. So it's an area that we can invest. I would rather talk about healthcare investment and healthcare cost, really. And I think Dr. Ola Brown did mention this. I don't need to reemphasize. The way we work has changed. Remote work has come on. And so IT is playing a bigger role. And we are moving into a fragile world as a result of COVID. So there's disruption, there's volatility, there's uncertainty, there's chaos, there's ambiguity, there's risk, and there's indeed what I would call diversity. However, the good side of all this is that every crisis comes along with some level of opportunity. So instead of disruption, leadership can provide an agile world and address disruption with direction, address volatility with vision, address uncertainty with understanding, address chaos with clarity, address ambiguity with agility, address risk with resilience, and address diversity with divergence. It's a great opportunity to embrace modern technology to drive effectiveness, efficiency, and adaptability. So what we require in the pharma industry is a knowledge-based leadership that will enrich professional collaboration in the healthcare sector, particularly very good collaboration among the various professionals. Using IT, for example, under COVID-19, e-commerce in the healthcare, retail healthcare grew by double digits, 13%, which just shows that COVID-19 will raise awareness of the need for healthcare. And I know every one of us, we have spent a little bit more money than normal on supplements, particularly vitamin C and a couple of other essential vitamins as we move. Part of the challenge we have in the pharma industry is the issue of standard medicine. So what standard medicine? We have problems of standard medicine when the active ingredient is lower than stated. We have problem of fake medicine when there's no active pharmaceutical ingredient. We have problem of falsified medicine when active ingredient itself is changed or replaced with other. We have cheating in medicine when active pharmaceutical ingredient is not declared, but it is inside traditional herbal medicine and makes it work. So regulators, we need to be empowered with resources of money, manpower, with producers of to deal with producers of this substandard medicine. We also have the challenge of resource supply issues, and looking at resource not just in terms of medicine, but also in charge of HR resource and financial resource. So when we look at the issues that are facing problem of doing business, lack of adequate supply of infrastructure, foreign currency regulation, access to financing are the major problem. So how do we solve this? We could solve it with more organized distribution that enables products that arrive at the port in Lagos to get to every nook and cranny of this country by government supporting mega distribution and regional hubs so that wholesalers will pick from those authentic locations. There's a challenge of poor political will, inadequate government healthcare budget. Professor Abayomi has already stated this, and I don't need to. And about less than 5% of the population have health insurance. So health is not yet a priority to each one of us. And this impact productivity of citizens and by extension, Nigeria's economic growth. Because the wealth of a nation is determined by the knowledge base of the people as relates to health. The Nigerian government can also make healthcare more affordable and accessible through quality service delivery, through strategies in reversing the brain drain by paying people. COVID has now shown that the healthcare professionals are far more important than the legislators. So government will need to do a lot to encourage private sector participation as well in healthcare by providing good financing, particularly for the pharma industry. There's a need for us to adopt technology. We cannot overemphasize this. We need to innovate to create unambiguous value for the stakeholders who consume and pay for healthcare, the consumers, the employers, the government. We need to capture the opportunity by investing in tech, by care delivery models, by managed care models, and the combination of the three. We need to invest also in creation of new clinical pathways that improve care delivery and outcomes. I served in the Lagos State University Teaching Hospital for 8 years. And one of the major challenges we had was to get people to visit primary health care centers rather than come to tertiary health care center. People are supposed to come there through referrals. So they waste a lot of time of people who are specialists who should be seeing referrals, and they are seeing primary health care patients. We need to move the orientation from delivery-centric model to consumer-centric model. We need to look at possibility of looking at community pharmacy in the private sector to expand their roles, to cover vaccination, treat basic malaria, fever, and other minor ailments, to take care of basic community health things, as we see in Europe and as we imagine in Americas. We need to refer to nearby hospitals and secondary health centers from these primary health care locations. The pyramidal approach will reduce pressure on teaching hospitals. We need to become more active managers of portfolio of assets, divest, collaborate, partner with government, and partner with ourselves. Instead of having multiple small clinics, why can't we come as a group of clinics, coordinated under the HMOs? Health is not a cost, but an investment. As I try to close, it's important for us to just pick up these few things. There's a need for collaboration of healthcare professionals, pharmacy in every hospital, and get GPs to also work in some pharmacy consulting as local. We need to build agile organization, particularly to drive efficiency, effectiveness, and adaptability. Leadership and talent capability of operating in the bipolar world that addresses Western world medicines and the Eastern world medicine, so that at the end of the day, we add that to our own nutraceuticals. If we really need to build local manufacturing, we must stop importation of what can be manufactured locally. There's a high product cost due to infrastructure and cost of money. That has to be addressed by government. There are a lot of delays at point of entry, clearing, high cost of money, and we need to embrace standard and produce nutraceuticals. The future of COVID shows that the process of generating a vaccine for COVID takes a long time, and it could take as much as 18 months to 24 months. If this is accelerated, we see potential 29 candidates, of which about 1, 2, 3, 4, 5, 6, 7, about 7 are in phase 3. It is from here that we are likely to get the solution. The advanced analytics set clear plan, therefore, is seeking for data on finance, social, provider-generated, as well as patient-generated data, which we're supposed to use data to drive our process. The crisis of COVID should never be allowed to get wasted. The pharma industry will need to transform itself. Like I did mention, they will become much more customer-centered culture. Customers want affordable quality healthcare services, and IT can actually help us to achieve this. So in addition, the critical milestone will be therefore to collaborate, to address distribution, to create advancement in biotechnology, get WHO certification. As we move into African free trade, it's a very big opportunity for us. In conclusion, the pandemic continues to offer exciting long-term opportunity for us. It will help us to gain market share. We need to grasp with the city, local government potential, that is step by step, we work on what is workable at city, we focus on city before we go to the rural area. And then we have to master the public-private partnership to drive efficiency, effectiveness, and affordability. We need to master the local dynamics and divide bespoke, divulgate agile solution will be best placed to develop winning strategy. The future of work is here and now. If we are not updating your knowledge and upskilling your skill the way you are doing today, you soon be an expert in an industry that no longer exists in the next few years. We just have to learn to keep educating ourselves about ways within which we can take advantage of the crisis for which COVID has brought upon us. Thank you so much, and God bless you.
Thank you very much, Lere. That was very comprehensive. Thank you.
Thank you.
We're going to try and shift our attention quickly to the questions. But just before we do, we need to take a 1 minute or so of the sponsor's ad. And may I remind you, while the sponsor's ad is showing, that you should please put your questions in the Q&A box, not in the chat box, please. We will be selecting questions from the Q&A box immediately. Thank you very much. So let's just pause briefly. Okay, thank you very much for that. So can we go quickly? I will start by just pulling some questions out of the chat box. And the first one I will pose to the Honorable Commissioner. I believe the Commissioner is still on. The question relates to customer service and how we can really improve customer service in the public health sector. That is this a key area of focus, and is this an area in which the private sector can actually play a role? Over to you, sir.
Thank you. That's actually one of our priority areas. Customer service, feedback, and we're trying to put in place some means of which we can get feedback from our clientele as they visit our primary healthcare facilities, our general hospitals, our tertiary hospitals, just to get a sense of what their experience has been in one of our public facilities. We're doing this through multiple strategies, of course, training in terms of client face, training in terms of more positive attitude. Of course, the bottom line when you're delivering healthcare is your competence as a healthcare professional. So by training, putting our staff through increasing levels of acquiring expertise through training is very important. But you know, the rapid turnaround of our medical personnel is something that's contributing to some of the experiences we have in the public sector, where, you know, as soon as we've spent and invested in the development of healthcare professionals, many of them leave our shores and go to greener pastures. And that investment, both in terms of their primary and their specialist training, plus their in-house growth, is all lost to the environment. But we have a number of, also we go through a lot of disciplinary processes where we get complaints from the community, and those complaints are taken very seriously. And we have a whole department that manages disciplinary action, manages performance through our disciplinary teams. So yes, we also feel that when we introduce some digital platforms, we'll be able to get much faster feedback from the community about their experience. Just like when you go to a business, sometimes you get on your phone a little message to rate your experience in the health sector. That's the kind of thing that we want to introduce alongside improved administration of our 3 tiers of medical delivery by putting professional administrators in place who obviously will be paying more attention towards client-face attitudinal issues. Thank you.
Thank you, sir. Can I also just pose the next question to you? The question is, why has it been so difficult to have effective public-private partnerships in healthcare thus far? You know, what is being done with the enabling environment to sort of address this?
So I think it's all a mindset where I think both on the part of government and on the part of the population that, you know, the majority of the healthcare delivery belongs in the ambit of government. And I think that's something that we really need to address square on. You know, as I said earlier on, our role is not so much to focus on delivery, but to focus on regulation and creating the enabling environment, and less so on healthcare delivery, and leave that to the sector that are able to do it in a more efficient and more effective way. So it shouldn't be government that's providing all the specialist centers. It shouldn't be government that's providing all the family medicine facilities. We should have some, definitely, and we should set the standard, but we should allow the private sector to drive that, and to drive it in a way that is efficient and economical. So I think on the side of government, we need to address our attitudinal approach to that, and you know, allow opportunities to partner with private sector much easier. On the part of private sector, I think, you know, they should be in a position to think about how they can partner with government more effectively and not be afraid to do so. And I think we're promoting more and more public-private partnerships in government at all levels, both at the primary, secondary, and specialist facilities, and with all the other ancillary supports that are required to drive effective healthcare delivery, such as e-health and e-governance, and all those other kinds of training institutions that are there to support the health infrastructure across the states. So I think there are lots of opportunities for for these kinds of engagements, provided we create that enabling environment.
Great, thank you, sir. Can we ask perhaps Richard, Dr. Richard Ajayi, can you also perhaps speak to the issue of PPP, given the fact that you wear both hats?
No, I think, thank you very much, Fola. I think, yeah, just to support the Honorable Commissioner, I think it's a mindset. I mean, in Lasut, where we are, I think we have about 13 different companies that are providing PPPs within Lasut, and a lot of them have been there for many years. We have a very clear governance process around them of engagement, making sure they meet the needs of the hospital, and it's working very well. And also from a personal point of view, in my businesses, I have a PPP with government hospitals that I've been running now for 6-7 years. It's all about engagement. I mean, we all want to provide services. So I think the opportunities are there, and I think it's a question of just putting the plan together and making sure that it's a win-win, or the opportunities are there, and I think they work very well. Thank you.
Thank you. Next question for Ola. Question is around, how do we create the awareness for Nigerians to see the value of investing, of local investments in healthcare? Very much like we've seen in, for instance, the agriculture space, which happened a few years ago and has really allowed the space, the sort of economic opportunities that it's seeing today. I guess both you and Dr. Ajayi had spoken to the issue of the business of healthcare, but how do we really, really create that mindset for local investors and, and even local consumers to really, put their money where their mouth is?
The first thing I learned in economics, I think it's like the first rule of studying economics. One of the first things that they teach you is that human beings respond to incentives and only incentives. So there was a story where I think it was in India. They had a problem of this invasive cobras. So they asked people, anybody that catches the cobra will collect money from government. So they caught all the cobras, but then people started rearing the cobras in their houses, like setting up cobra farms inside their houses, so that they'll now rear all the cobras, like 50 in their backyard, and take it to the government and say, we found these cobras. So there were so many houses in that region raising cobras, baby cobras everywhere, so that they'll go and collect that reward. And it just shows that human beings respond to incentives. And if we want investment in healthcare, then there have to be incentives created. I think we're quite simple human beings. If the taxation is low, if the rewards are high, if the enabling environment is there, just like, the danger of raising a cobra next to your children, talk less of 50. But people were doing it because the right incentive were there. The government had created an enabling environment that the risk of having live poisonous snakes in your house was, comparative to the reward of taking them to the government and saying that we found this snake. So if you can create an environment, an enabling environment for growing snakes next to your family, then definitely, if we create the right framework of incentives for healthcare manufacturers, for healthcare providers, for healthcare retail pharmacists, for instance, for the whole value chain, then I think that definitely the health investment will come. And I think we have great examples of that in Nigeria. So for instance, cement was never an attractive business. So it was going to be very, very difficult for us to compete with Chinese in cement. Well, an enabling environment was created, and a few people went into it and were very successful in telecommunications, the same thing in banking, the same thing. And I hope the next one will be healthcare.
Absolutely, thank you. I'll just ask a question of Mr. Lere Baale. Professor Baale, the question is around the pharmaceutical sector and the level of fragmentation, poor regulation, and of course, high incidences of fake drugs. And then how effective are the various associations in the pharmacy space, in the pharmaceutical space? How effective can they be or are they being in tackling these issues, perhaps through advocacy or actual implementation of policies? I don't know if you can speak to that.
Thank you so much, Fola. The reality is the pharmaceutical sector is highly fragmented. That calls for collaboration, which I've stated. It requires collaboration of the members of the value chain to work together towards a common goal. And that will only happen if, for example, government puts in place things that will help them to work together. The pharmaceutical sector is not poorly regulated. It's actually over-regulated. What is happening is that the non-professionals are having a upper hand because of the poor state of the police of the industry. It is not that there are laws in place. And what we also require to be able to drive down the issue of fake medicine is to make our products affordable and of good quality. And this is possible. Many will not be able to understand it, but the issue of incidence of fakes dates back to over 30 years, when the concept of pricing was the primary determinant that government was using to buy medicines from the private sector. So all kinds of substandard drugs started to emerge. It is particularly important for people in government to also understand the fact that the cheapest drug is not usually the best medicine as well. So people have to be well educated, and people needed to raise awareness. And like Dr. Olabran mentioned, incentives should be put in place to help the people in the industry to actually go on self-regulation and to ensure that quality medicines are produced. Like there's too many proliferation of laboratory. A single laboratory in a region can take care of multiple pharmaceutical companies, rather than each pharmaceutical company coming up with a sophisticated lab for few products that they are producing. So that could be centralized laboratory that tests products of various companies around. And that way there will be economy of scale. The product cost will become less. There should be specific allocation of fund that is within the single digit, if possible, about 5 to 6% interest rate that is supposed to be pumped into the healthcare industry that will benefit both pharmaceutical and the other members of the healthcare industry. That will go a long way in reducing opportunistic producers of fake medicine. Thank you.
Thank you very much. I think we need to start pulling this together and pulling this to a close. With each of you, I'd like you to please perhaps just think about your closing statements. But if it were possible for you to address the issue of universal health coverage and health insurance from each of your perspectives, that would be useful as you just give us your closing thoughts. Thank you. Can I start with Ola? Ladies first.
I think that, as we're approaching this, really exciting conversation about universal health care and care for every single Nigerian, all 200 million of us, I think it's really important to bear in mind that it might not have the same look or aesthetic as what you see in developed countries like the UK or Australia or America. And that's simply because we are poor. And there's nothing wrong with being poor. The only problem I think that we may have is maybe we have the mentality that Nigeria is a rich country. So we need to develop universal healthcare, but we need to develop it, a package of care, universal healthcare that is in line with our resources and realistic for the level of resource that we're able to bring in and our fiscal state at the moment in terms of the budget as well. So my main sort of point is that universal healthcare can become a reality, but we just need to be realistic about how that's going to look and not expect it to look the same as people that have 100 times more money.
Thank you. Richard?
Yes, thank you. I'll just close with 2 points. First, on universal health coverage. I think Rwanda achieved universal health coverage with a per capita spend of $50. Burkina Faso, $45. When Thailand achieved it in 2002, I think they were on $70. Our per capita spend of about $80 to $90, I think if the political will propels it, I think we can achieve a lot more than we currently do. and looking at effective management of resources. The other point I wanted to make is about the concept of management and management gaps. You can't, the fact that you can bake bread doesn't mean you can run a bakery. Running a bakery, you have to define where you buy your flour, where you get your water, what kind of ovens you're going to use, how you're going to power your ovens, HR issues, pricing, how you distribute your bread. And I think it's the same with healthcare. The fact that you're a doctor doesn't mean you can run a hospital. And I think we need to look at ways of building capacity for management. And I think a lot of these are part of the issues that are slowing us down in terms of actually making sure we achieve the best with the limited resources that we have. Thank you.
Thank you. Professor Baale.
Thank you so much. Universal healthcare coverage is very possible. We have to make do, like in any strategy, you start with what you have. And we have in abundance nutraceuticals. We have a lot of products that are useful that we can make available at primary healthcare level. We start from there. Then secondly, we also make use of what is available in form of other resources, like money. We have community pharmacy. We have a couple of different things that we can adapt and utilize and reduce the heavy pressure in tertiary institutions and secondary institutions. Thirdly, I think Dr. Richard hit the nail on the head. The truth is that we have a lot of professional healthcare professionals. They are very solid, they are highly cerebral, but managing business is a totally different thing. And we cannot expect all of them to go for MBA. So what I would suggest is that every single healthcare institution should make management, business management, as an integral part of the curriculum, not like this 2 or 12-hour thing. It should be more like a 12-month major thing, so that when they get out, they are not waiting for government to employ them. They can set things up and run it well. Because the knowledge of health economics, as I found out in relating to the healthcare practitioner, is extremely low. And so you can see it, and a lot of resources are wasted in hospitals, both in the private sector and the public sector. So solid knowledge about management is key.
Thank you very much. Prof, I think you're still with us. Can
Yes.
I let you have the last word, as in Professor Abayomi, please, the commissioner?
Thank you. Yes, I've been enjoying the conversation while I'm working. So I think several key points have been made. I think it's important that we realign our thinking, that we strengthen the relationships between private and public sector, that we start to do things differently, and that we learn from the experience of Ebola, COVID, and the rising incidence of non-communicable diseases. And one thing we're doing in the health sector in Lagos is that we're beginning to think of health more holistically. So we're looking at what we describe as the One Health paradigm. There's no point spending a whole lot of money on health while you disregard your environment and your food chain. So the One Health paradigm is looking at you as an individual, the health of your environment and the health of the food you eat, because you can be as healthy as you want, but if your environment is toxic, then that's really not an issue that is conducive to longevity or good quality of life. Similarly, I think we need to pay a lot of attention to the type of food that we eat and how we produce our food. Lagos is a large consumer of food, but do we know where this food comes from? You know, how is the food grown? How is the food transported into Lagos? You know, what are the conditions under which, what kinds of chemicals are they exposed to? You know, we're also looking at our water, our air, the stress level in a city, in a mega city like this. So that also brings in, you know, other ministries like urban planning and transportation. So I think, you know, we've got to look at a broader picture now. We've got to look at the holistic definition of what does health mean, you know, and not just focus in silos and just think about blood pressure and diabetes and, you know, nutrition, but rather looking at the broader spectrum of healthcare delivery. I think you can all remember that around the world when we all went into lockdown, that for the first time, many cities could see the stars and the sun. You know, that's a reflection of how toxic our environment is. You know, even in Lagos here, you can't drink water that comes out of the ground. You'll poison yourself. You know, so these are all very critical issues that we must start to look at on a more holistic level and a more ecologically sound basis. You know, and health and ecology, in my opinion, go hand in hand. So I'll leave you on that rather philosophical note. Thank you very much.
Thank you very much, Prof. And well, it leaves me just the last word of turn it from Prof's philosophical words to the business side, and really just to, as we speak to the chamber and chamber members, to say, you know, we hope that this has sort of spurred you on in thinking about how to think about the business of healthcare, how to think about investing in healthcare. If nothing else, the numbers or the projected numbers tell us that, you know, healthcare as a business or as a GDP of healthcare in Africa is anticipated to be $260 billion by 2030. That's in the next 10 years. And will be the third largest healthcare spend in the world. And we're expected to create up to 16 million jobs. So I hope that that sort of economic argument, you know, and the arguments we've had today, the discussions from the economic perspective have helped. I think what has also been extremely enlightening has been the commissioner's own perspective of the fact that the political will is now very much there for the private sector and for PPPs. We've heard about the fact about how incentives are really important for private sector investment to come in. And I think we want to probably bring that incentive discussion, some of it back to government to sort of think about that, so that it's not only the regulatory side, but also to think about that too. We've heard time and time again about the importance of management and particularly the business of healthcare. And of course, as Prof has also told us, the ability to deal with future pandemics. We will have to integrate you know, pandemic readiness along with what we're dealing with in terms of communicable and non-communicable diseases into our healthcare system. But certainly, if we can be much more, if we can bring a business approach, then I believe that that's something that we would have gotten out of the current situation we've found ourselves this year, and that we've learned from and can take forward. So thank you all very much for, you know, being with us. It's been 2 hours or so, but I think it's been well worth it and well spent. So I'll just like to hand over to Mrs. Bisi Abayomi for closing remarks. Thank you all.
Thank you very much. Thank you, Ms. Laoye. It's been indeed, like you said, a very interesting and well spent afternoon. So it just leaves me to thank our sponsors, Ajayi HMO. Thank you very much for your generosity. I'd like to thank all our speakers, starting with the Honorable Commissioner, Professor Akin Abayomi, Dr. Ola Brown, Dr. Richard Ajayi, Professor Lere Baale, and of course, our moderator, Ms. Fola Laoye. Thank you very much for a very enlightening session. Certainly, I am more enlightened about the future of healthcare in Nigeria than before the program. So thank you very much. To join us at the NBCC, the details of our various social media platforms will show shortly on the screen. And if you want to join the NBCC, there's a link in the chat box where you can click on, and it will take you to our website where information on joining is available there. Also, you have seen on the screen the details of our forthcoming program. We ask that you join us for the first one coming up on the 27th of August, and the second one, which will be looking at the telecommunication sector post-COVID on the 15th of October. So thank you very much on behalf of the NBCC, to our panelists, and to our very engaging audience. We look forward to seeing you again soon. Have a good evening. Thank you.